shoot a hole at the palm of your hand. Why don't we leave it at that? Nothing to say, but everything gets in the way. Seems you cannot be replaced, and I'm the one who will stay. Oh.
Welcome to Eczema Explorers. I'm Aboud, your guide on this podcast journey through the world of eczema. We're diving to the depths of this condition, uncovering valuable insights from experts and individuals who have navigated eczema's challenges firsthand. We have Dr. Sama, a dermatologist with expertise in treating skin's condition. Also, we have Dr. Abada, a research scientist, with our eczema warrior, Aboud, who has graciously agreed to share his journey with atopic dermatitis, the most common type of eczema. Thank you all for being here. So eczema is more than an irritating skin condition. It's a global concern affecting 10 to 20% of children and 1 to 3% of adults. The prevalence has been on the rise in the recent years, making it crucial for us to understand it. Join us for a series filled with practical tips, expert knowledge, and personal stories that shed light on eczema. Let's embark on this enlightening exploration together. So let's start with asking Dr. Sama about what causes eczema and why do some people get it while others don't.
So first of all, thank you Aboud for having me. While the exact cause of eczema is not fully known, but for understanding the reason behind eczema, it involves a complex interplay between genetics and the environment. Certain genetic variations can influence how the skin functions, potentially compromising its barrier and making individuals more susceptible to eczema. If you have a family history of any type of eczema, asthma, or hay fever, you are more likely to get this condition. This happens because of specific changes in your genes that affect your skin barrier cells and skin immune system. However, it's important to note that while genetics lay the groundwork, environment factors such as allergens, irritants, and stress can trigger or worsen your eczema symptoms.
I want to add to Dr. Sama's words that the climate factors, including the change in seasons or extreme cold and dry weather, can be a significant reason for eczema. As based on the data from 2017, the 5 countries with the highest rates of eczema are United Kingdom, Iceland, Finland, and Denmark. You all know these countries can be extremely cold in the winter.
Oh yes, I agree. So Aboud, can you share with us the start of your eczema journey? How did it all begin?
Sure, it's all being innocently. A torn spot on my arm that begged for attention, a gentle scratch. I thought it's just a reaction for a new product I use. But then, like a harmful spirit, it spared its wings. I thought point I was in concern and went to the dermatologist, one as good as Dr. Sama.
Thank you.
She told me that I had atopic dermatitis, a type of eczema due to filigreem deficiency. I was clueless. Then what is this? She told me that filigreem is a protein responsible for building a strong protective skin barrier. Without enough of this protein, bacteria, moisture, and viruses enter, leading to eczema, and unfortunately I have lack in protein as it's in my genes.
Oh, this must be exhausting. So Aboud said that his dermatologist figured out that he has eczema. Then how can a person know that he or she have eczema? Is there any symptoms to figure it out? And how does the diagnosing process goes?
Talking about symptoms of eczema, it can look like other conditions. However, allergy symptoms may include abdominal pain, cough, diarrhea, dry skin, eczema, headaches, hives and swelling, itchy red or watery eyes, nausea, vomiting, shortness of breath, skin rash, sneezing, sore throat, stuffy, itchy or runny nose, swollen lip, tongue, eyes or face, wheezing, tightness in your chest, or allergic asthma. If you have any of these symptoms I mentioned, I think you should see a dermatologist. Dr. Sama is our dermatologist in this podcast. She can explain how diagnosing of eczema process goes.
So diagnosing eczema involves examining the skin for redness and rashes, exploring the patient's medical history for connections to conditions like allergies or asthma. Your provider might offer tests to rule out other conditions and confirm your diagnosis. Tests could include an allergy test, blood test to check your causes of the rash that might be unrelated to the dermatitis, a skin biopsy to distinguish one type of dermatitis from another, and importantly, listening to the patient's experience to tailor a personalized management plan.
This podcast has reminded me one of my long journey towards recovery. But I remember going through all these tests to know exactly what type of eczema I have. There's a bunch of tests I have gone through. The test that Dr. Sama has mentioned, but each of them is for different thing.
Yes, exactly. Going through these, you might need an allergy blood test if you have an allergic rhinitis or high fever, usually the result of pollen, pet allergies, or mold aspergillosis. Anaphylaxis, which is a severe and sometimes life-threatening allergic reaction to certain food, insects, stings, or other allergens. Contact dermatitis, caused by contact with irritants such as chemical detergents, poisons plant, or certain metals such as nickel allergy.
But talking about my condition, I have done skin biopsy test during the procedure. Your provider removes a small sample of skin. Looking at the sample under microscope,
Oh, so to know which type you actually have, you must do the skin biopsy test. Going through the internet, I found that there are several types of eczema. Each type has unique triggers that can affect your skin barrier functions, including atopic dermatitis, contact dermatitis, diarthritic eczema, neurodermatitis, numeral eczema, and seborrheic dermatitis. Moving to the risks for eczema. Is there any risks of having eczema? Can it affect our body functions?
Actually, yes. The eczema has some risk factors because it causes skin barrier dysfunction, and as we know, the skin is the first line of defense. The skin barrier is the first line of defense. So it leads later, the dysfunction, it leads later to the development of food allergy, asthma, or hay fever. Bacterial skin infection, viral skin infection, and it also affects someone psychologically because it could lower his self-confidence and the patient will be bullied. So aggressively treating eczema in children and taking steps to restore normal skin barrier function may lower the risk of future development of these conditions.
So, moving to the treatments for eczema, I've heard for dealing with the itchiness of eczema, you could use some creams, lotions, and specific medications can be helpful in calming down irritating skin for people dealing with eczema. Individuals often embark on a trial and error process to discover what suits their unique skin needs. It's all about finding what works effectively to manage eczema and maintain skin comfort. But is there like a specific way for eczema to be treated, and how does the doctor prescribe it?
I remember my the dermatologist have asked me a lot before giving me a treatment. He asked me about my family and if they have a history with eczema, And is there anything that make symptom worse? And if I noted something triggers or worse your symptom, like a certain soap, and a lot more of question that I cannot remember.
I think you have chosen your doctor wisely. Of course, asking the patient question is one of the most important steps so the doctor can give the right treatment. Each person and body react differently to the treatment. To get the right treatment, it needs time, especially for skin problems. It always needs a lot of time. So the treatments for eczema could include using a sensitive skin moisturizer through the day when you have a dry skin. Apply moisturizer when your skin is damp after a bath or shower. Then you can apply a topical medication to your skin as advised by your provider, like topical steroids. Take an oral medication like anti-inflammatory medicines, antihistamines, or corticosteroid to reduce itchiness and swelling. Oral medications are very important. Immune suppressant drugs help regulate how your immune system functions. And lastly, light therapy to improve the appearance of your skin and remove blemishes.
I've heard that moisturizers are always the first thing to take if you have eczema or having a dry skin. But you should choose your moisturizer wisely too. There are several options of moisturizers available to treat eczema. So doctors suggest that you choose a skincare products that are hypoallergenic, fragrance and dye-free, gentle for sensitive skin, and especially do not include any preservations or stabilizers.
Yes, however, when it comes to a definitive cure, we're looking into a treatment that targets the messed up immune system behind the eczema. These treatments could work better and last longer, giving people with eczema more help. And that's where the future holds promises. And no, there is no cure that ends eczema. Eczema is a chronic disease, which means it can go away and come back unexpectedly. Treatments are very effective in reducing the symptoms of itchy, dry skin. Researchers are working on a new medication targeting specific aspects of the body's defense system for better eczema treatment. They are also exploring gene fixes, studying skin microbes' role, improving creams, training the body's response, and investigating fresh ideas for innovative treatments.
Thank you, Dr. Abada. I'd like to invite our eczema warrior, Haboud, back into the conversation. Haboud, in your experience, how have you navigated the array of treatments available for eczema? Have you found certain strategies more effective than others?
Great question, Aboud. It's been quite general for me. I have tried various cream and medication, and honestly, it's been about finding what works for me personally. Moisturizing regularly has been cornerstone, and certain medication prescribed by my dermatologist have provided a relief during flare-ups. I'm optimistic about the ongoing research in immune targeted treatment, as it could offer more comprehensive solution for the long term.
Absolutely, Aboud. It's clear that each individual's journey with eczema is unique, and finding the right combination of treatments requires patience, collaboration with healthcare professionals. Thank you for sharing your insights.
So regarding treatments, a quick disclaimer that we want to pair what we are doing externally with the internal work as well, because as I mentioned before, that stress and anxiety can cause eczema. So working on managing stress and being able to switch off from constantly worrying about what's coming next, importantly, it also means making time to relax, have fun, and practice self-care.
Yes, and that's a very important point. as in the NES landmark for 2020, patients survey eczema and masked. People said stress was the single biggest trigger for their eczema flare-ups, with significantly more women, with 57% affected than men, with 41%.
And
Anxiety and stress are common targets that cause the eczema to flare up, which then create more anxiety and stress, which then lead to more eczema flare-ups. So believe me, it's a cycle that you don't want to enter. So try to stay positive, and talking to a friend when you're feeling down might help a bit too. I know it's tough, but finding a way to distract yourself can be helpful sometimes.
Of course, it is important to have someone to talk to and get support from when dealing with eczema's emotional side.
So, as we wrap up today's discussion on eczema, understanding eczema is a joint effort, from its patterns to seeking better treatments. A huge thanks to our experts, our dermatologist, Dr. Sama, our research scientist, Dr. Abada, and our patient, Aboud. Thank you for listening. Stay well, everyone.